I'm calling 1-700 HIV treatment sites closed after Trump aid cuts, a headline you'll want to know about. The U.S. Department of State launched PEPFAR, the President's Emergency Plan for AIDS Relief, in 2003, and it's credited with saving 26 million people in over 50 countries. But in 2023, President Trump decided to trim the program's funding, saying low-income nations should take on more costs for HIV treatment and prevention. According to a new survey by AMFAR, HIV charities around the world had to suspend services for 3/4 of those at highest risk: women who sell sex, men who have sex with men, transgender people, and people who inject drugs. The study was conducted under the Trump administration's policy that required agencies to report service changes, so those organizations documented how abruptly they were forced to cut back. A second, multinational study, which will also be presented at the International AIDS Conference in Rio, found the same trend hit children hard. The report says PEPFAR supported treatment for about 77,000 fewer children in 2025 than it did the previous year, a 14% decline. That's a staggering loss at a moment when everyone knows the threat of LAJU. The United Nations UNAIDS data again highlight the tragedy: nearly half of all children living with HIV graphically, for 1 in 2 kids that has not even been offered treatment. In response, the State Department released a statement defending the program, claiming the Trump changes strengthened PEPFAR through clear strategic direction, promoting greater recipient country ownership, and sharpening the program's focus on measurable health outcomes. But the timing of the cuts and the loss of sites appear to undermine that claim under the surface. Many public and private data programs have been scaled back or shut down because the aid cuts cut the budgets for those operations. The story is that, because the U.S. had been the single biggest financier of global HIV care, it is now pulling back, and the effect is that the number of people achieving viral suppression is likely dropping. The findings are due to be presented next week at the large International AIDS Conference in Rio de Janeiro. They will be the first large survey to document the concrete, on-site impact of the Trump administration's policy. Dr. Beatrice Grinstein, president of the International AIDS Society, said, "We unfortunately are going through a very complex and difficult moment, where all these good achievements are challenged by the new policies." The end of the story is that the program that changed lives for decades is now being cut back sharply. The research tells us that at least 1,700 treatment sites had closed, that 1/10 of the highest-risk populations have been left without services, and that 14% fewer children are receiving treatment than just a year before. State Department officials have urged the public to not jump to conclusions, but the evidence: 3/4 of organizations forced to shut services, 77,000 fewer children treated, 1,700 sites shut, makes it clear that Trump cuts are having a real, measurable impact. If you need a deeper dive into what this means for global health or for families in the developing world, stay tuned. I'm just getting out, but this is a story that matters, and it's still being unfolded. Thank you for listening.